Greetings, everyone. Welcome to this webinar of the Reproductive Health Supplies Coalition's System Strengthening Working Group. We're so glad that you could join us today. My name is Sophia Asan, and I warmly welcome you today. So we are really happy to be co-hosting this webinar on the localization of humanitarian supply chains with Pamela Steele Associates. Just a couple of brief housekeeping notes. You will be remaining in listen-only mode to avoid background noise, and we do have a full agenda for you today. Which will include a Q&A period at the end of the webinar. And so please feel free to enter questions or comments in the chat or in the Q&A portion of the Zoom platform at any time. The questions will be addressed during the Q&A as time allows. Also, you can feel free to introduce yourselves by writing in your names and organizations in the chat window. So as I said today, we are really pleased to be co-hosting this webinar on the localization of humanitarian supply chains. As we all know, localization and regionalization of supply chain functions has become of rapidly increasing importance to SSWG and our members. While it was already an important topic before the pandemic, after 2020, there was greatly increased momentum to have the functions within supply chains managed and operated fully, ever more efficiently and effectively by local or regional organizations. And then, of course, after the events of the last 6 months, the urgency level has increased ever more to be able to ensure the localized management of the various supply chain functions. And that includes for the provision of technical assistance. So today, we're pleased to collaborate with Pamela Steele Associates on this vital topic. Pamela is the founder and CEO of Pamela Steele Associates, or PSA. Pam is a health supply chain expert from Kenya who specializes in improving access to medicines in Africa. Over the last 30 years, she has worked for several organizations, including Oxfam, UNFPA, and UNICEF, and she now leads her own supply chain consultancy. Pam is an executive committee member of the Reproductive Health Supplies Coalition, and she's a proponent of gender equality and recently began an initiative called Girls on the Move to encourage more young women to work within supply chain organizations. So I'm now very happy to hand off to Pam to lead us forward.
Thank you very much, Sophia, and good afternoon to everyone, and thank you for joining today's webinar. I'm reminded of what former USAID Administrator Samantha Powell said, that if we truly want to make aid inclusive, then local voices need to be at the center of everything we do. And that's the spirit of our discussion today. And the World Humanitarian Summit in 2016 called out the persistent power imbalance that keeps those most affected by crises farthest from decision-making. Localization is about changing that, moving from a top-down model to one where local and national actors lead, supported by collaborative partnerships that deliver really important impact for affected communities. So last year, I had the privilege of contributing to this important agenda as a consultant for the Fritz Institute on a USAID commissioned project. Our work focused on how supply chains can better support localization by entrusting local and national partners with enhanced roles in humanitarian response, building networks that connect local actors with humanitarian and commercial partners, and supporting innovation, preparedness, and faster, more cost-effective local response. Our study focused on Kenya as we saw the potential of places like Nairobi with its strong infrastructure, supplier networks, and interagency collaboration as a hub for local procurement and supply chain innovation. And we also learned from Nigeria. And of course, the arid and semi-arid lands, that is ASAL, Humanitarian Network, showed how local organizations are already driving real change on the ground, delivering water, food, cash, and protection, and responding to crises with deep community connection. This project reminds us that when local actors lead with the right support systems, responses are faster, more relevant, and more sustainable. And so without too much ado, I'm delighted to hand over to my colleague Akinyi Awara, who is a specialist in human-centered design, co-creation, who joined me in leading workshops with stakeholders as part of this work. Akinyi will walk us through the project's core lessons. And we are honored also to hear later from Ahmed Ibrahim Abdi, who is the convener of the ASAL Humanitarian Network. He will share strategic insights on advancing localization from a policy and systems perspective. Thank you, and over to you, Akinyi.
Thank you very much, Pam, and thank you to everyone who's taking the time to listen in as to what exactly it means to move from just talking about localization, designing localization, to operationalizing what localization actually looks like, whether it is at the country level or at the community level. We no longer can shy away from the fact that for development to work, for aid to work, you need to have the people that are mostly affected, or the people that are directly interacting with whatever thematic areas it is that we're designing for, included in the conversation as to what exactly does it look like to be prepared whenever it is a disaster strikes, what goes into the conversation on creating resilience within communities, what is it that is already available at the grassroots levels as far as designing local systems towards resilience and disaster response, and how do we translate that, or how do we share that within mainstream spaces. So I'm going to go directly to get started on presenting some of the insights that we came across when we were going through the process of designing for localized humanitarian supply chains in Kenya and Nigeria. Now, when we started in this project, when Pam talked about programming being the focus of people that work in humanitarian aid and development, I come from the programming side. So it was a very interesting journey, learning what exactly goes into operationalizing the certain things that we talk about beyond just the conversations on programming, building log frames, and etc. Now, the framework for reference referred to the fact that whenever it is the disaster strike, the people that are at the forefront, the first responders, usually are part of the communities that are directly affected. However, these people still, at this point in time, are relying on external resources or external knowledge or external experience to be able to respond whenever disaster strike. Now, the one thing that we realize is that this is not for a lack of initiative at the local level, a lack of knowledge or experience. However, it was as a result of the way humanitarian aid systems are designed. So the question that we started by asking was, what exactly would it take for us to see something different? Now, when we were doing the initial research, the initial literature review, we had a lot of information that was mostly published by entities that either work within the continent, and very little information by entities that are actually located within the countries that we're working in, that have lived experience as far as what it looks like to activate supply chains in the event of a disaster response. Now, when we went into, you can just go to the next slide. When we went into figuring out what it would take to actually follow through whatever systems, whatever stakeholders were put in place, as far as understanding what the humanitarian landscape, the humanitarian response landscape in Kenya looked like, who the actors were, and what exactly were the implications that the operationalization bit was having on the success of whatever programs it is that we were seeing. So co-creation process started from us doing general discovery, just getting to understand what is there as far as localization is concerned. Is anyone else looking into the same topics or the same trends and the same thematic areas that we were looking at? And then we moved into now designing the design framework itself. So who were the stakeholders that we were going to include? What was the experience in terms of interactions amongst these stakeholders going to look like? Because initially from the literature review, there was a lot of thematic areas coming in, and we did not want to create a situation where instead of having dialogue that would result into insights that would actually be productive, we end up in a situation where it is A versus B. So creating the right kind of environment, getting the right kind of people at the right kind of time in the right kind of spaces was really important in defining whether or not this new methodology in terms of co-creation that we were testing, that had previously only worked at the community and grassroots level, was actually going to be applicable to stakeholders at this level. So we mapped out the different tiers of stakeholders that were involved, starting from the NGO and United Nations level. So we looked at who did we have from the Interaction Standing Committee on Humanitarian Response? Who is it that would be interested in this particular conversation? How were they involved? What were the different power tiers that were in place? Who did they work with within the countries and communities that we were designing for? Then we moved into the country level. So who were the local stakeholders? What levels did we have the local stakeholders? Because in the case of Kenya and devolution, local did not just mean looking at people that work at the national level. It meant going to the counties and even devolving further down to figure out who are the stakeholders that were directly involved when you talk about humanitarian response and humanitarian action. And would including them in this conversation actually result in us getting insights that would be useful to the conversation that we were starting? Then we moved from just looking at the general players to were we able to find case studies in the field of local people that had actually started the process of actualizing everything that we were making assumptions about, or this hypothesis that we had about what localized humanitarian action would look like. And in the process of mapping and having conversations with these stakeholders, we ended up narrowing down on the strategies for Northern Development, which had done extensive work in terms of creating localized frameworks for humanitarian response in collaboration with their partners who are an NGO. And we realized something while we were doing the mapping process, that at the end of the day, in as much as when we talk about localization, the implication is that we have local actors leading the process. What we were going to see eventually, a recurring theme, was the requirement for collaboration, but even more, defining what the terms of collaboration and what a balance of responsibilities was going to look like when we have localized systems. Alice, next slide. Now, when we started the review process, there are a few things that kept on coming up. The first was a conversation on capacities. So were local organizations equipped enough, whether it was in terms of monetary resources or tools, expertise, everything that was required to be able to lead the response process in the event of a disaster. Now, a lot of conversations were the back and forth on what exactly the gains had been over the years from the several efforts that we were seeing as far as capacity development is concerned. These were mostly led by international actors in the effort to work towards creating improved local capacities. Now, the question here was, from the literature that we reviewed, why is it that despite continuous aggregated efforts towards capacity development, when it came to negotiating as far as transferring some of the responsibilities that are required for disaster response to the local people, we were still getting conversations coming up on questioning the capacities of local organizations. And this was a conversation that mostly ended up falling within the operationalization bit. So what we were seeing is local organizations were being brought on as either participants within this particular programs, response programs, or as tertiary stakeholders within response activities that were directly linked to communities that these people worked in. So the question was, when it comes to capacity, what exactly is it that defines what the capacity debate was? So when you say local organizations did not have enough capacity or still need to work towards developing their capacities, what exactly did you mean by the term capacity? That was the first question that we had for the stakeholders that we're working with. The second bit that was linked to capacity was accountability. Now, the argument was because of the nature of international organizations and the time that they have had to grow and develop, they have had enough time to build systems that are able to withstand or that are able to be efficient when responding to disasters. Now, these systems become a little bit erratic with the attempt to transfer them to local organizations, because apparently accountability was an issue. And the reason why accountability was an issue was because there's a discord between what locals consider as indicators for success versus what the international organization required to be reported on as indicators for success. So this then brought on the question of context. When we talked about defining what the capacity was, the question that we needed to answer was, is it that we have two different or two competing definitions as for the capacity requirements for operationalization of response activities that are locally led? So was it that the international partner is defining capacity as item A and the local organizations, given their lived experience, was defining or viewing their own capacity through lens B? So we needed to understand what was the context in which that we were having this conversation on localization. Then this led to the conversation, of course, on resources. Who has the resources when disasters strike? Where are the resources coming from? Do the locals have enough resources to be able to respond or to become fast responders, or do we wait for resources to be disbursed from point A, get to the local people, then we can start the response exercise? So all of this conversations, all of these thematic areas led to a very important element, and that was integration. So we were seeing parallel efforts as far as not just the conversation on localization, but whatever actions different entities were taking towards ensuring that whatever it is that is being built actually works for communities. So you had competing definitions as far as localization is concerned from international organizations. When we looked at it locally, you had gaps in terms of integrations that were coming up that was based off of who is working with who internationally. Now, the one thing that was clear was to answer the question of capacity, to consider the thematic area on accountability and to understand context and to make whatever resources it is that we had available work, we had to think about what would integrated localized supply chains look like. Were we able to integrate local actors within the humanitarian space, moving just beyond the programming level or doing joint fundraising to now the operational systems that were actually used to respond in the case of a disaster. The one thing that kept on recurring from whatever literature it is that we were reviewing was we still were yet to see enough documentation coming from the local organizations, the local stakeholders, in terms of research on what exactly it looked like to create local systems. So a lot of the information that we had were from international or foreign entities. Next slide. Now, by the time we were getting to the point where we are looking at who do we bring to the table to have this conversation, we mapped out and reached out to stakeholders. And for the INGO session, we had 6 different INGOs respond. We had the World Health Organization, we had UNICEF, we had Save the Children, we had Oxfam, we had AMREF, we had the Kenya Red Cross. Now, from this co-creation session, the findings were quite interesting to see what exactly international actors considered to be qualified as localization in general, in just the definition of the term as it occurs or as it is used within development and humanitarian context, and then filter this down to how this applied within the supply chains. Next slide. So we saw a lot of validation of the information that we had gotten from the literature, but the context in which these thematic areas were being brought up was slightly different. That is mostly because we had direct inputs from the stakeholders that were involved at this particular level. Now, what we realized from the perspective of international organizations, when they talked about local capacity and whatever issues were coming up in terms of local capacity, it was the difference in terms of systems. Because given the nature of international INGOs, by virtue of how long they have been in existence, how deep their systems run, the process of integrating local organizations to start learning whatever the operational systems were, whether it was in terms of financing, whether it's in terms of supply chains, whether it's in terms of reporting, the process of transferring this knowledge was, one, a process that requires time and investment that, according to the people that work in supply chain, was being done as far as programming is concerned, but hadn't been devolved yet to the operationalization bit. So the conversation had begun, but the conversation was only happening from the programming side. So we had a lot of information on indices to measure different things or whatever indicators are supposed to be considered when you are looking at how involved people are or how involved the local organizations are. But when it comes to the actual systems that support an actual response exercise, they hadn't gotten to the point where this had been devolved. Now, the other issue that they had was different INGOs had different systems as far as humanitarian aid is concerned. So they first of all had to figure out, if at all we are talking about localization or transferring these capacities, did they require to integrate whatever information they had or whatever systems they had, so that then whatever information is transferred to local organization is standardized. So this was coming from things that they were already facing within the humanitarian response space. So for instance, different INGOs had different requirements for what their suppliers were supposed to present as far as documentation is concerned. Now, this lack of standardization was also showing up in the quality of response exercises that we have, because in the event of a disaster, you have 3 or 4 different organizations, each responding to the same issue, each and every one of them having their own methodology or their own mechanism as to what the response exercise is supposed to look like. Now, this was creating a lot of issues with the response process as it was even before you introduce the question of localization. So the issue in capacity, local capacity, ended up being an issue of what exactly is required to develop local capacities, because each and everyone had different thoughts or different systems on what operationalization looked like. So this then brought in the question of integration. If at all we were seeing disintegration amongst the international stakeholders, what is it that this contributed towards within the local systems? So we saw the lack of standardization becoming a barrier to capacity development. And then the other thing was, because of the nature, again, the same things that were preventing or that were becoming a barrier to the transfer of knowledge from international parties to local parties was the same thing that was preventing the transfer of information amongst international actors. So they were not able to share information or to be able to share systems or even data amongst themselves, which was making it even more difficult to define what data, what information, what capacities are supposed to be transferred locally. So then now this brought in the issue of contextualization and whatever resources it is that we consider in the event of a disaster response. Now, the thing was, given the way the systems are set up, the resources were very dominant to people that were at the top of the pyramid, and they became scarcer the lower you got on the pyramid. Now, this was an interesting thing or an interesting conversation to have, because one of the assumptions or one of the hypotheses that we had for localization was, in the event of a disaster, the local actors are your first responders, the ones that in direct contact with whatever it is that is happening on the ground. Now, the interesting thing that we will see later on when we look at local NGOs was information in the event of a disaster was getting to the INGOs before some of the local NGOs were even notified of whatever it is that was happening locally. And this was because the INGOs had more integrated information systems. They had the technology, the manpower, and the means to ensure that they get information as it was happening. So most of the local NGOs were actually getting information from the INGOs on whatever it is that is happening locally. Now, the question was, if at all we are talking about contextualization and us having scope becoming an issue on who is supposed to intervene when and where, was the issue of context also something that affected systems? Because one of the assumptions that we had was whatever systems it is that we have, in as much as we needed them to be agile, the systems were supposed to be separate from all of whatever changes it is that we are seeing that might affect the quality of the response process. So this was a question that was left open by the international actors as one of the things that they would have loved to work on, to design with the local actors to figure out whether they could come up with specific indicators for when, where, how, and who should be involved whenever it is that we're talking about contextualization, not just from the programming bit of humanitarian responses, but whatever systems it is that they could come up with that they would support. Then this brought about the issue of accountability. So this was interesting because the accountability wasn't directly linked to local organization, but the local stakeholders, specifically suppliers. Now, when we were talking about capacity, they talked about the lack of or diminished capacity for local suppliers in terms of keeping up with requirements for international organizations when it comes to procurement. However, similarly, like within the same breath, they talked about different organizations having different requirements, which means if you're a supplier working within a specific area, you have to be well-versed with whatever it is that the different international organizations require. Now, it was very interesting that the system in general, moving aside from just organizations that work within humanitarian aid, the market and other stakeholders that were involved within the humanitarian response process did not have whatever knowledge and whatever capacities are required to actually be able to compete within the local procurement processes. So now, the other side of this was very interesting because NGOs are perceived to have a lot of money to spend. So this created the issue, again, of accountability, where suppliers would quote price A for organization A and price B for organization B, depending on the perceived spending power that was accorded to each organization. So this created the conversation on localization moving just beyond the immediate actors, who in this particular case were the local and international NGOs that are doing the response process, to other stakeholders within the ecosystem, like the suppliers and the regulatory bodies that are concerned with the procurement and supply chain processes within both Kenya and Nigeria. Next slide. So based off of this conversation, we saw 3 key thematic areas coming in to encompass whatever the recommendations were. Number 1 was based on integration. People thought that for us to have the conversation on localization, we need to have a multi-sectoral technical working group. So it moved beyond just having NGOs and local NGOs to talking about people like the military who have established supply chains and are really good in response in terms of disasters. Who did we need from the government? Who was required to contribute as far as the suppliers and the markets were concerned? So what the conversation was that for us to actually have any actionable insights beyond just the design process, and even during the design process, we needed to move the conversation beyond just who was in the room. Then the other thing that was coming up was the data processes. This was the documentation and guidelines that determine what data is going to be collected and who it is being collected from, the processes that are coming up as far as cross-sharing data between NGOs, international actors, between NGOs and local organizations, and between both parties and other stakeholders involved within supply chains. So then this brought in the other recommendation, which was creating a standardized approach to capacity development. Because if we were going to talk about transferring responsibilities to local actors, and we have varied international actors and even other stakeholders interested in what humanitarian supply chains were supposed to look like, then this meant the international organizations had to figure out what exactly would standardization look like, first of all, for themselves as actors, and then what would this look like when you include all of the multilateral actors within one room. So after this, the next step was for us to talk to the local NGOs. Next slide, Alice. And this was quite interesting because whatever assumptions or whatever hypothesis it is that we had in the beginning, we were seeing the same thematic areas recurring, but the way they were showing up was different. So you had issues like capacity, accountability, context, integration, all showing up, but the way in which they were showing up was dependent on who we were having the conversation or who was involved within the co-creation session. Now, for this particular session, we had 8 stakeholders, and this included people that work within the humanitarian response, both within health, climate change, and whatever it is that we had mapped in the beginning to be issues as far as disaster response is concerned in Kenya. So the findings were not that different from whatever it is that we had heard from NGOs. The presentation of the findings, however, was different. And that is because we were looking at a different perspective in this particular case. Next slide. So where we were talking about capacity, with INGOs, and I'm talking about the gaps that they were seeing in terms of transfer of knowledge, in terms of humanitarian systems from INGOs to local NGOs. What we were seeing with the local NGOs was that they had been part of countless exercises in terms of capacity development. The issue was whatever it is that they had been part of as far as capacity development wasn't based on what their needs were. Most of whatever it is that they had participated in was exercises driven by international NGOs to ensure that local NGOs were able to perform to their capacity. But the conversation for the local organizations were, our needs are different, and therefore some of the things that we are required to adhere to or to aspire to are not applicable to whatever it is that we are facing in the ground. So now the question was, are we able to create a balance as far as capacity development is concerned, so that we have the same way we are doing co-creation to redefine the systems, we also have a co-design process on what exactly capacities are required both locally and internationally, because what we realized is the capacity development was required on both ends, both for local organizations and for international organizations, on what exactly the local requirements were and how to deal with that. Then the other bit that came up was integration. So now this answered the issue of capacity and accountability. What the local organizations were talking about was most of the things that are required for local organizations and some of the things that we were seeing as very top heavy for international organizations that we were having an issue on transferring might not be feasible to transfer to a single organization. But if you had a body of local organizations, they would be able to take on whatever the requirements are in terms of capacity. This would directly affect the issue of accountability, because when you had more than a single organization working together to ensure that whatever resources it is that were accessed, whatever information it is that was being provided as far as responses are concerned, whatever issues that were being raised in terms of accountability could be taken care of, because then you had dual accountability structures. So you had accountability within the organization itself and accountability at the network level. So this would then satisfy the question of, can local organizations be trusted to take over whatever the responsibilities were? So then we had the issue of contextualization, and this was interesting because it was also tied to sustainability and resources. Whatever it is that we were seeing was local humanitarian organizations were able to adjust and contextualize depending on the nature of the disaster. Now, what this meant was, were they able to transfer their modes or their models of contextualization to whomever it is that was funding the exercises, so that instead of having resources coming in that are rigid and they're not allowed to make any changes depending on whatever issue it is that they're dealing with at the grassroots level, they were able to have agile agreements as far as utilizations is concerned, depending on what was coming up at the grassroots level. So this, according to them, would then result into sustainability. Because if you have a pool of resources and you're able to respond in good time without necessarily having to go through 3 or 4 different levels of approval, then number one, you're able to respond to issues as they come up. Number two, you're able to make changes that make sure that whatever intervention it is that you're putting across actually benefits the community that you're working in, so that we don't have organizations with resources tied that they cannot use because the resources are tied to specific indicators and specific terms and conditions provided by whomever the funder is. The next slide. Now, after this session, we went to now validating both whatever the recommendations were. You see some of the things that the recommendations the local organizations provided were similar. They talked about sustainability planning. And this was because of the nature of the humanitarian space, according to them. Whenever it is that there was a disaster response exercise, they had a lot of funds and a lot of resources coming in. However, The second that the response period came to an end, somebody said that international organizations would leave with everything, including the cups and mugs that they used to take tea and drink water. Now, according to them, what that meant was with every single instance of response, or every single time they had something to respond to, the local organizations were starting from scratch. That, according to them, was not feasible. So the way to handle the sustainability planning bit was to make sure that whenever it is that international partners were talking about capacity development, it had to go beyond capacity development that is just program-based. They had to work with local organizations to not just train them on whatever operation-based capacities were involved, but to also commit resources that would lead to this organization's growth. Then their commitment to making sure that these two things work was on integrated accountability systems. So that whenever it is that you had funds like crisis modifiers being released from international partners, the integrated networks that local organizations have created and were going to create would make sure that whatever questions as far as accountability, as far as capacity, as far as sustainability were concerned, was being taken care of by the fact that people were banding together to work on creating systems that ensure that we are not just responding to disasters, but we are building whatever the requirements are to make sure that our communities are resilient. Next slide. So after we had the two conversations with international organizations and we had conversations with local organizations, we had interviews with suppliers. Now, this was interesting to carry out in terms of information, because now we had moved from just talking about humanitarian aid in general to having to navigate the rules of the market. So we had limitations in terms of getting information because of IP, because of company policies, because of the different things that these companies had to adhere to legally. One, within the company themselves, and two, between the relationships of their suppliers and their clients. However, we saw a few issues coming up, like transparency and fairness. Are we able to make the procurement, the pre-qualification process transparent? So that if at all supplier A gets approved, we can be able to see what it is that made supplier A be approved. And in the process, are the other suppliers that have not been approved able to get enough information that would allow for them to grow their capacity to eventually be able to participate in the process? The other bit was to localize product specification. The issue was for a lot of response exercises, most of the product specifications that were being given to local suppliers apparently did not have local requirements or local specifications. So you either had to go to a supplier that has links to whatever markets it is that produce the products that meet these specifications. So that meant that by virtue of the nature of the products that were required, a lot of local suppliers were left out. The other thing was quality assurance. And this was coming up specifically with local suppliers. Again, this is tied to the product specifications. Number one, we did not have, or we do not have enough information on what the product specifications are. Number two, whenever it is that there was an attempt to work with local suppliers, because they had not been trained on producing goods with specific requirements, most of them did not meet what was required by international and local organizations as far as responses was concerned, humanitarian responses were concerned, both for food commodities and specifically for health commodities. Then the other bit was communication responsiveness. There was a question as to when information is deployed to a supplier that this and this and this is required versus the time that they have to organize themselves and actually get whatever goods it is that they're required or commodities they're required to supply, and it getting to the last point or the last mile access point. The other bit was logistics and delivery, and this was for local people because most of the areas that were mostly affected by disasters happen to be rural areas. Now, the process of getting these goods from point A to point B for NGOs was easy because they have whatever means of transportations are required, including moving goods by air to the point of response. However, for local suppliers, they had to rely on whatever local systems there are. So if there are no roads, you get questions and issues of vehicles being stuck. You had issues of security because a lot of them were saying sometimes you get the tender to respond to a call for commodity supply, but then making sure that the goods get there is up to you. And most of the areas that they were working in are sparsely populated areas with some level of security risk. Then the other bit was collaboration for sustainability. For a lot of the local suppliers, for them to meet the capacity that was required for some level of procurement qualification, they had to work together. Now, whatever systems were required to actually integrate supply activities amongst the suppliers had not yet been set up. And that is mostly because of competition within the market and the lack of the frameworks that would actually allow them to do that. Then the other bit was on innovation. So this mostly revolved around technology and enhancing that to improve the response time, to improve their access to information, to make them more agile as far as response is concerned, for them to be able to prepare. So were they able to have information in time and pre-generate kits before they're actually required based off of whatever data and information they could get from forecasts on possible disaster events. So after we had conversations with the 3 tiers of stakeholders, we brought everyone together. And this was one because we needed to understand whether the different parties were all in agreement with whatever information it is that we had gotten. And number 2, to create a session in which the different perspectives would be made evident. Next slide. So we did a reconciliation of whatever it is that we had gotten as far as the insights. We did a validation process. Then from the validation process, we got enough information to be able to build a case study. So were we able to link what we had gotten from the stakeholders to now things that were actually happening within an organization's space? Next slide. Next slide. So we created a case study and we were looking at 3 things. Number 1, were we able to create a baseline on whatever the joint recommendations were based off of an organization's operational systems? Number 2, were we able to validate whatever information it is that we had gotten from the different stakeholders by creating a case application in the context of a singular organization that was already working within the space? And number 3, based off of the comparison of the data that we had gotten from the various stakeholders and from this organization, could we create a hypothesis for success should the stakeholders decide to implement whatever the findings and whatever the recommendations were from this particular process? Next slide. So the organization picked was strategies for northern development. And from this, we were able to see field-based evidence on this organization implementing some of the recommendations that were being provided. So we realized one thing: localization already existed. This is by virtue of whatever information we had gotten from localized, from local NGOs. And most of the NGOs that we had were actually part of the ASAL humanitarian network. And the information that we had, as far as the depth and the breadth of work and resources that had been created by this coalition of non-governmental organizations towards making sure that they had figured out what localized humanitarian response looked like for them as local actors, was quite extensive. So SND, first of all, worked in like 5 different counties. Now, we realized that in as much as, yes, they had worked towards establishing local systems, there was still a lot of challenges towards creating actually efficient, I don't want to use the term efficient, I'm going to say sustainable, localized, fast response capacity systems. Now, this was mostly due to issues that were around the initial investments within the government systems that were available within the spaces. So you find an issue of things like roads. You found an issue of you still had some level of disintegration among stakeholders working at the county level. So you had people that local organizations still having to compete in terms of response resources with international organizations. Now, they gave us a case in which they had a flood response. It was flood response. And you had various multiple organizations all responding to the same issue, each and every one of them insisting on working within a specific area of response, thinking that that was what would lead to tangible impact within the community. But then the result, according to them, was a lot of confusion and a lot of delays in terms of the response exercise. So the question was, if at all we were to look at the localized capacity for response, how then do the systems that the locals have created affect the ability of other international partners to come in and intervene within the same spaces? Because what they were talking about was, yes, you might have created the local systems with partner A, but then partner B is not yet aware that this is how things are supposed to be working within this particular space. So in the event of a response, you still have miscommunication and a little bit of disinformation, not by the fact that these systems do not work, but by the fact that whatever information was built within the systems has not been disseminated wide enough. Then the other bit, you had them talking about whatever it is that is considered as standard procurement systems by international actors were totally different from what the local realities were. So when we were talking about local supplier capacities, when we were talking about the absence of accountability systems or the inability to qualify as far as commodities are concerned, all of this were because the design process or the qualifications and the specifications of specific disaster response procurement and supply requirements these decisions were made away from the local communities. So by the time you get to the community, there's totally different information. And because of the lack of sharing information amongst different organizations and different partners, you still had the issue of suppliers looking to become millionaires by virtue of gaining supply tenders by international response actors. Then that also eventually led to the other issues that come with an unregulated system, like quality assurance. So they talked about the unreliance of whatever it is that we have as the standardized quality assurance mechanisms within the country. So this was for either food commodities or health commodities. They had a lot of issues with these institutions undermining whatever it is that was provided as the local guidelines for commodity certification. So whatever the issue was, the suppliers could not compete because the international organization does not recognize your local body for standardization as qualified. Then the other bit, the last bit again came up was capacity. So they talked about the lack of contextualized training, and this was also happening with whatever stakeholders it is that they had interacted with. Next slide. Now, the most important bit for this entire exercise was for us to figure out all of these findings that we had come up with, all of these findings that we had gotten from the various stakeholders, could this actually be applied in the context of a local organization? And we had enough information from S&D. They talked about institutionalizing anticipatory funding, the crisis modifiers bit. They talked about stakeholders coming together to create county level technical working groups. So devolve the participation of disaster stakeholders from just the national level, go all the way to all levels of devolution. Then the other bit was, are you able to create standards of practice as far as what the requirements are for local suppliers? And can this be co-created with either local organizations and international responders so that everyone has the same information as far as what the requirements are? Then the last bit was, can we be able to share information across all of the different stakeholders on what exactly the information is based off of disaster monitoring systems, the response qualification and monitoring and evaluation data? Are we able to get information not just amongst the local organizations, but sharing of information between local actors and international actors? Now, next slide. The one thing that came out of this exercise was the fact that depending on what your definition of co-creation is, the level of intentionality required when you're creating spaces that would allow for people that have information within specific thematic areas to actually contribute, without it becoming an exercise that completely just looks at whatever it is the gaps are, or becoming an exercise of party A versus party B, requires some level of consideration on not just like the research process or the design process, but on the experience of all stakeholders that are contributing to that party. We saw elements of ownership by people committing to implementing some of the things that were recommended. We saw a lot of honesty in terms of the information that was provided by stakeholders, by the nature of the spaces that we created. And the final thing that they talked about is whenever it is that we're talking about localization or designing within these spaces, we cannot just pull things out of the ether. All of this information starts with whatever it is that exists, whether or not we actually like the state of whatever resources and expertise and everything that is available within local systems. And from our perspective, the local organizations have done quite a lot towards creating information systems, joint response systems, a lot of the required elements that would then lead to them taking over whatever the capacity is required to now say. We have localized systems for operations as far as humanitarian aid is concerned. Now, we are going to go to the next stage, which is probably going to be very important because you're going to hear from one of the conveners of the local networks that led to why it is that we actually believe that most of the insights that we got from the field are actually doable. So I'm going to hand over to Pam to do the introduction.
Thank you very much. And I will want to save the time so that Ahmed can tell us more. We are honored to hear from Ahmed Ibrahim Abdi, who is the convener of the Arid and Semi-Arid Lands Humanitarian Network, who will share strategic insights on advancing localization from a policy and systems perspective. Welcome, Ahmed, and we have some 10 minutes, if that should be fine, and then we leave some 5 minutes for some questions. I've not seen any questions come on the chat. But Ahmed, over to you. Take it away. Thank you.
Yeah, thank you very much, and it's glad to be with you. And good morning, good afternoon, good evening for all the participants who have joined. Largely, quite a lot has been said in that setup, and it includes even some of our members having really contributed to that write-up. So what I will say is, in a nutshell, because I'm summarizing because most of it is already in it, is surely this network first, who are we? We are around 30, 10 of them are, to 11 of them are women-led women rights organizations. We work in 10 ASAL counties in the northern of Kenya, and that is where most of the disasters really happen, which fluctuate between drought, conflict, floods, outbreaks, humanitarian supply chain being really messed up, and quite a number of things. But what I wanted to say is most of the supply chain in the humanitarian system and even the localization agenda itself, what we are talking about is people's aid to people in need. So the rest of us in between are supposed to be facilitators and enablers, not blockers. So are we really doing our job well, or we are creating compliance hurdles of money that has come from a taxpayer somewhere to a person who's really in need because humanitarianism and humanity really ask for it? So when you really look at those kinds of things, and over the 30 years that I've been in this field, support systems are the ones that create the most hurdles. So from our way of really looking at ASAL humanitarian, instead of one local organization and having been in this setup since 2016 World Humanitarian Summit, we were there, we were pushing for all these different things. We were happy that it will take effect quickly. And sadly enough, in the humanitarian outlook that was done by LNAP recently, you could still see what was flowing, and we are backsliding. So what the grand bargain was supposed to really achieve was supposed to have been a grand bargain, because the resources available are not available for meeting the needs of people. So what it was supposed to do is negotiate a wider flow of resources from the little we had, to leverage it and to be able to really look for resources from governments, from philanthropies, from communities, from private sector. But largely the humanitarian system has remained looking inwards on compliance, so many things, and reporting on a dollar that was just collected. Why not leverage that $1 for $10 and report on $10? So that is something to be left for the House to really think through, and as you are part of the system, really see whether you're an enabler or really a problem, because most of the support systems are still at the status quo. And I just wanted to highlight top line, what at ASAL Humanitarian Network, why we moved in this space. From 2019, we realized local actors did not have the resources. What was the best way to go forward? So we came up with an approach where we said we have to move away from a single entity to a collective. From a local crisis being looked at, but making it a national agenda. So from an advocacy and bringing the people together to be able to do this, then building the voice. So from building that voice and processes, then we said we need to have locally led action. for us to achieve an effective aid system in Kenya. So in Kenya already, most of the things are, including the local actors, include government. So there's devolution, there's quite a lot of legislation, everything is in place. So what is amiss? The only thing that is amiss is the early warning does not relate to early action. So as local actors, we just said, what do we need to do? Because we need to be, we are in the front line, we have all these things, information, knowledge, and being part of it. So it was to develop partnerships and also develop allies. And then be able to make local stories and processes to be linked to national and then to global space, continental and global. And from that perspective, internally, we said, what do we need? We looked at the data available, then we brought it together, we developed a trigger model internally. That trigger model now said, out of the 10 counties that we work in, if a crisis were to hit or it's in the process of coming, and looking at the different indicators, especially for drought, which NDMA was already collecting a lot of data, is which county is most in need, what is going on in different places, and we aggregated that data from looking at deviation from normal, and then that data was used now to do advocacy, and then say spaces. And as we pushed this process, the turning point from 2019 to demonstrating the processes slowly with like-minded organizations, saw the journey come to 2021 when the crisis of the drought hit. And then we realized this drought needs to be declared by the president as a crisis in Kenya. So in between the normal assessments, we did a snapshot assessment together with like-minded agencies and with the support of Oxfam, Kenya Cash Consortium, which is made up of Acted, Concern, Acted, Concern, and Oxfam. We did that analysis, and that analysis helped us to be able to advocate. I remember we did used that to push for a flash appeal to be created by the UN. And then we tallied and pushed a number of governors with the FCDC. And then from there, then some 85 leaders had to go to the president to declare. But why should we wait for the president to declare a crisis was the issue. So with that kind of limelight and processes, we're able now to get space in coordination through showcasing. So we became part of the HCT Light that was created. We were able to do presentations at the Kenya Humanitarian Partnership meetings. And then from there, then we said, what is the best way forward for us to do? So AHN now moved away from just doing harmonized approaches to showcase frontline action to also policy, advocacy, influencing, and things like that. So we have a number of steps which we did, which some of them were already done. So the first key thing is internally we are a set of local organizations. Map out the capacities, so capacity sharing can easily be done. So we believe that none of our members has lack of capacity. Why? We can deploy as the local partner is able to get the skills they need. These skills they need is related to money. I can hire the right person if I had the right resources. So it's not a preserve of any individual. It's as long as you have the right resources to be able to attract the right. So we have capacity sharing, and then we develop rapid response teams and looking at how to develop locally led surge models. That is one. So across all the different members. We have come up with what we're calling harmonized approaches. From a supply chain perspective, we said, how can the local actors be able to do last mile? So the infrastructure, the ability to do multi-purpose cash transfer at scale has been showcased in the 2021-2023 crisis. We were able to have the local actors, already 16 of them have the infrastructure of M-Pesa, a platform where Kenya has around 96% penetration in, and the organizations have a mechanism to do last mile, and convinced the partners to be able to, if your money has already come into your spot, why would you want to keep it? Why not be able to create a turnover within a local partner to do the last mile? as long as the processes are done well. So under the cash model, we have an 8-step model, which now enables coordination. It enables community-based targeting. It enables a scientific verification of whether the right community has been targeted. It enables a know your customer verification process. It entails a complaint and feedback mechanism, and payment is done after compliance documents are signed together with the partners, and the last mile is done by local actors. That enables local actors to get more resources, and multipurpose cash transfer has really been a key thing. The second bit that we did was the e-voucher mechanism. And the e-voucher mechanism is linked to what we're calling market-based solutions to be able to enable local suppliers at the grassroots to link up to mid-level suppliers at county or at a regional level. And is there a possibility of the way the design is supposed to be, which we are still testing the final bit, although we have the platform, is can a local supplier at a lower level tell us who they work with at a mid-level supplier, and the middle supplier, we go to them, and together with this e-voucher mechanism, develop a mechanism for credit systems. They already have that relationship, so that then these things can be available. So why will a woman at reproductive age be unable to get her basic dignity kits from a shop like Sugar and Tea Leaves? That is the question now that supply chain process is supposed to be asked. So what is it? If we are going to be moving in-kind goods from outside the markets, are we building it or are we collapsing it? When do we need these kinds of setups? I just want to go back in life when I was a young kid, in our times when maybe colonial governments were there, just before I was born. The question, what we used to hear was, it's about to rain. And because the governments did not have, at that time, colonial power did not have all the resources to make the good roads, then roads were closed for 3 months. So, but planning used to happen, that food stock is available for 3 months in spots where things. So the question was, were they more in investing in storage? And so if now we don't want to work on storage systems investment, then we have to make the roads all weather for them to function better and to be able to. If not, why are the supply chain systems not really investing in the systems themselves? So that is why the e-voucher mechanism we feel will be a game changer and will be available to. But the key problem is supply chain mechanisms start functioning when resources are available. When are resources available? Late in time. So if a flood is predicted to be in 3 months' time, why are we waiting? Is that money available in advance if the system is supposed to activate? Then we are looking at, you have already talked about capacity, and then due diligence. Yesterday, an organization has done a due diligence on me. Why will a local actor be put to due diligence is close to 10 to 6 in a year of organizations who already have relationships, who are in bigger networks. Either they're in START network together, or they're in ACT Alliance together, or they're in the UN together. Why will we be having these due diligences repeated? Why won't any of them pick it and use it like a passport? So those are the frontiers that we are really looking at. And finally, just to wrap it up, what do we need to go forward? So the alert-based systems must be able to work in a way that they predict these things. Triggers are created up to the hotspot areas, thresholds are in place, and the money is ring-fenced alongside the contingency funds of governments. And then we create virtual pool funds that are ready. We don't have to have the money ourselves as local actors. As long as the triggers are there, can we have pre-signed agreements in advance to release those resources in time and have it in the process? I'll leave the session with, are we talking about delivering pipelines or we want to deliver lifelines? Thank you very much.
Ahmed, thank you so much for those insightful thought-provoking information that really wrap up the day. And I just wish we had time, because it's just becoming even more interesting as to what has already been done on the ground. We were sharing what we researched and found out, but the reality is that you've been working with the network for quite some time, and there's a lot going on. I think being a Kenyan, I know that there's a lot of strides that have been made in terms of emergency, disaster responses, preparedness response and recovery by the local actors. And I think, we hope that we'll carry this conversation in another day or in another format. But I'm seeing a question here from Susan Jogo. Susan is asking whether, that we know collaboration and partnerships with government, national and county is key, and to what extent did we engage the government in the assessment? Susan, to answer you, we worked with counties. In fact, we had Nairobi County represented. We had Northern Kenya County representatives, including Kisumu. So we did involve them, because at the end of the day, you'd say that the responsibility of a country's population in a disaster situation, whether it is in healthcare delivery, rests with the government. And so the government is the first, should be the first respondent, ideally, although the government, especially in Kenya, has devolved a lot of responsibilities to county levels and therefore then to community, which is why the ASAL network is able to do what they can do. And yes, we did work with the government. The voices were strong there. If there's any slide there, you would see the photo of the county government disaster risk management committee representatives in that meeting. And Francis Ojemu, you say support systems are those that create the most hurdles, and that this is deep and resonates. I think this was a point that Ahmed raised, and I'm glad that it spoke to you. And yes, our time is up. I'm just so delighted that we had this conversation, and I think I would then hand it over now to Safia to sort of wrap up. I can see members are still here engaged, means that this topic is so important to majority of them. And so over to you, Safia, to close for us. Thank you.
Thank you so much. And thank you, Pam. Thank you, Ahmed and Akini. We appreciate your time and your insights so much today. We'll be sharing the recording and the presentation that was presented today to those who registered for this webinar. And we look forward to holding additional conversations around this topic, as well as other timely supply chain topics for health commodities. And thank you so much for joining us today. Have a great rest of your day. And thank you so much to our esteemed speakers. We appreciate your time so much. Bye now.
Thank you. Thank you so much.
Thank you and bye.
Bye.